What's going on, everyone? It's Alex here from Aleks Physio. So today we're going to be chatting about 5 reasons why surgery may be an appropriate option for you if you've been struggling with back pain. Now, of course, this isn't medical advice. This is just my expert opinion based on working with orthopedic spine surgeons over the last 2 years, in addition to my 5 years of experience as a physiotherapist. That if surgery is an option, that you discuss this thoroughly and outweigh the risks and benefits with your medical team. That can include your family physician, your physiotherapist, and your orthopedic spine surgeon. So let's get started. Number 1, you failed conservative treatment. Usually if you tried physiotherapy for 3 months and or pain medications, and if you haven't gotten any benefit or have even had worsening symptoms in your back pain, and radicular features, if you have any leg pain associated with it, then this is a pretty good indicator that physio probably isn't going to help you for your specific condition. While working at the hospital, I've noticed that individuals who have had surgery, when I asked them whether or not they had tried any physio, a lot of people didn't even try it at all, which is unfortunate because of course there are individuals that can benefit quite a bit from physiotherapy and rehab with their back pain and can avoid surgery altogether. The other individuals that I chat with have tried physiotherapy, but when I discuss about what some of the components with the physiotherapy involved, it was a lot of passive modalities like ultrasound, TENS, heat, very basic exercise, and nothing that really symbolized to me that it was a comprehensive treatment approach. But there's always going to be a subset that you can do everything perfectly and you just don't respond to therapy. Number 2, your leg symptoms are more dominant than your back symptoms. This is a question that I've noticed a lot being asked by the orthopedic spine surgeons with regards to what is more irritable. Usually they ask this question as a ratio question. So if you had to put your back symptoms and your associated leg symptoms on a ratio, how much of it is leg symptoms, how much of it is back symptoms. And if it's primarily leg symptoms, then surgery usually has a better prognosis with regards to helping eliminate or even severely reduce the pain that's referring to your legs. But it doesn't have so much of a strong prognosis with curing the back pain. So if you find that your leg symptoms are the ones that dominate, then surgery may be appropriate for you. Number 3, you have neurological findings, which include changes in your dermatomes, myotomes, and changes in your reflexes. So your dermatomes are regions in your skin that correlate to a specific segment in your low back. So for example, if my L5 nerve root was irritated, then I may display some numbness or tingling in the L5 nerve root distribution, which is along the inside of my foot or my lower leg area. Myotomes, on the other hand, are a group of muscles that are innervated by a specific spinal nerve root. So for example, if I have myotomal weakness at the L4, L5 nerve root, then the muscles that are responsible for that movement are your dorsiflexor, so pointing your toes up, and pointing your ankle up. Ankle up is at L4 and toe is at L5. So I might show weakness in those muscles when they're tested by myself or one of these spine surgeons. Or in severe cases, you may have foot drop. So myotomal changes, dermatomal changes, and reflexes. So with reflexes, we're looking at your patellar reflex, which is with one of those reflex hammers, and also your Achilles reflex. Your patellar reflex is your L3, and your Achilles is your S1. So if there are changes from side to side, so if you have symptoms going down the right side of your leg, you might show absence or decrease in the reflex of that specific patellar tendon L3 or S1 compared to the non-affected leg if the symptoms are just on one side. So those are some tests that we would be looking at. Number 4, you have positive MRI findings. So there's research that supports that people can have findings on MRI and have no symptoms, but for the individuals that had a clear mechanism of injury and subsequently developed back pain and referring leg pain, and when an MRI is done, it shows nerve irritation or spinal canal stenosis, which is narrowing of the spinal canal where your spinal cord runs. Now, there are cases where if you do have disc herniations, that the herniated disc tissue can actually spontaneously resorb and return back to its start position. It really just boils down to how long you've been having the symptoms, how bothersome and how it is affecting your quality of life, and what other measures you've tried, and to determine whether or not this is severe enough for you to be willing to wait more time for the discs to resorb, or if you go on with the surgery. Number 5, changes in your bowel or bladder function. If you have damage to your cauda equina, this is called cauda equina syndrome. This is a medical emergency because as a result, you will have, or you may have, changes in your bowel or bladder function. Thanks for watching. Hopefully you learned a thing or two in today's video. If you have any questions, please feel free to comment below, and please subscribe to my channel if you find my information valuable. It really helps my channel grow and allows me to reach